Upon receiving your box from Schrafts, you're going to get a nice placemat, and it's going to serve as a visual guide to help you go through all of your contents in your box. So here you're going to see that we have the gonal F pen, and it shows you that you have a sharps container as well inside of your package. When you're ready to use your gonal F pen, you want to take it out of the refrigerator 15 minutes prior to using it so you don't have a cold, uncomfortable injection. The first thing we're going to do is we're going to open up the box. This medication should also be stored in the refrigerator upon receiving it, and it will be labeled as such. And we need to put it back into the refrigerator after each use. So Morgan, you're going to see that you have a pen here, and then you're also going to have a whole bunch of these little cups, okay, with paper on top. These are actually your needles that are going to get attached, okay? So the first thing that you would do is you would take your pen out of the box, okay? You're going to uncap your pen. And then you're going to see that there's a little dial on the end of the pen with a number in the window, okay? So you're just gonna dial up to your dose that your doctor told you're going to be using, okay? So your dose is 200, right? Okay. So ready to use it. Just going to dial your pen up. So you see the number 200 in the window, okay? And then from there, let's say in the event you dialed past your dose, you would just dial the pen back down to 0. It just dials right back in, and then you would just carefully redial to your dose. So after you dial up to your dose, the only thing that you have left to do is attach a needle. So you're gonna clean this tip of the pen before each use. So you're just gonna open up one of your alcohol swabs that you have. Clean it off quickly. Then you're gonna take one of these cups with the paper on top. You're gonna peel it open. You're gonna stick the tip of the pen into the cup, and you're gonna push and twist to the right with some firm pressure. And then when you pull the cup off, you're gonna have a needle attached with a safety cover over it, okay? So then from there, you're gonna be ready to do your injection, okay? So to do your injection, you're gonna be using your abdomen. You're gonna go 2 to 3 inches away from your belly button, either to the left, the right, or below. So anywhere in that U-shaped area, you can do your injection, okay? So I recommend sitting down to do the injection regardless of who's going to be doing it. Just easier to pinch the skin up that way. So this is my skin. So we're going to carefully uncap the needle when we're ready. You're going to clean the skin with an alcohol swab. Okay, then you're going to pinch the skin up to create a little pocket-like pouch for the needle to go into. And you're gonna go straight in with the needle all the way in at 90 degrees. You're gonna push on the button on the end of the pen to dispense your dose. Okay, they're just gonna hold it there for an extra 5 seconds just to make sure that you got everything. Okay, then you're gonna remove the pen from your body, and you're gonna take that same cup that you attached the needle with, and you're gonna push back into it, and you're gonna twist to the left and attach the needle. And then this little cup would just go into the sharps container. Okay, Morgan, so once you've completed your injection, you could just put the cap back on the pen. Okay, you can put the pen back into its case. You can leave it out on your nightstand or wherever you please, because it's only going to be good for 28 days once in use.
Okay. So I don't have to put it back in the refrigerator?
No, even though it does start out in the refrigerator, it does not need to go back into the fridge once you start using it, okay? Because it's only going to be good for that 28 days, regardless if you put it back into the fridge or not. So to store it at room temperature, put it on your nightstand, wherever you please, okay?